East Central Southern Africa Health Community, or ECSA Health Community for short, is a regional health organization. We were formed in 1974 to foster regional cooperation in health in the region. So what we do is we work with ministries of health in our member states: Kenya, Lesotho, Malawi, Mauritius, Swaziland, Uganda, Zimbabwe, and Zambia, and Tanzania. We work with them, we identify common challenges, and we look for common solutions. We have a number of technical programs that we are running. We have a program on family health and infectious diseases at ECSA Health Community. And in that we look at a lot of issues, including the infectious diseases, including maternal, child, neonatal health, and all manner of other issues that fall under that. Then we have a cluster that is looking at issues of capacity development and human capacity development, human capacity and health system support. So we do a lot of work in that respect. And through that, we have a number of colleges that have developed, and we are working in the countries to help train specialists that can help bridge the gap that we have in the health workforce. We have a program on non-communicable diseases, food security and nutrition, and we are doing a lot of work with the countries on various non-communicable diseases, various interventions on food, and also working with other sectors to ensure food security in the region. We then have a cluster program that looks at knowledge management, monitoring and evaluation, because we generate a lot of information. So we need to bring this information together. When we meet with the ministers, for instance, they are busy people. How do you package the information for them? But also monitoring and evaluation in all we do in the various countries. In addition to those 4 core programs, we have separate projects that are supported by different funding agencies. The World Bank is currently supporting 3 fairly big projects for us, through which we are strengthening laboratory services and disease surveillance networks in the region, in the East African region. They are also supporting our response to TB, as well as strengthening the health systems in Southern Africa. But they are also supporting us in our response to cancers in the region by helping us equip the countries to have proper cancer registries. The Global Fund is supporting us to work with one of the supranational labs in Uganda to support countries in 18 countries. I mean laboratories in 18 countries, to strengthen their capacities in detecting tuberculosis. So the 65th Health Ministers Conference which opens tomorrow on the 19th of March, will be hosted at the Hyatt Regency, the Kilimanjaro in Dar es Salaam. It is hosted by the United Republic of Tanzania, and the conference chair is the Tanzanian Minister for Health, Community Development, Gender, Elderly and Children, the Honorable Ome Mwalimu.
As ministers responsible for health in our respective countries, we are committed to see our countries being counted among those that will reach and surpass the Sustainable Development Goals. By the end of this meeting, we will come up with concrete and relevant resolutions that will be of benefit to our countries. We do, however, remember that we have met before and made very sound and practical resolutions.
That the Right Honorable Prime Minister of the United Republic of Tanzania will officially open the conference for us.
Tanzania. Ladies and gentlemen, please, let's put our hands together for our guest of honor.
Good afternoon and welcome to the 65th Health Ministers Conference of ECSA Health Community. Right Honorable Prime Minister, on the occasion of the 65th Health Ministers Conference, in its 45th year of existence, ECSA Health Community is arguably the oldest health-specific organization in the region. And I'm delighted that we have in our midst our sister, Dr. Mbolo Lewanika from Commonwealth Secretariat, for it is from the Commonwealth Secretariat that ECSA draws its origins. Right Honorable Prime Minister, we hold this conference at a time when the region, and indeed Africa as a whole, finds itself at a crossroads. But I'm comforted that at moments when Africa has found itself at crossroads, at critical moments, when Africa has called for bold leadership, at crucial moments when Africa has looked for inspiration, on those occasions when Africa has required ingenuity and innovation, the Tanzanian nation has stepped forward to provide the leadership and to inspire Africa to act to greater effect.
Performance of the health system in the ECSA-HC member states has been a mix. In view of the above regional platform, such as ECSA-HC, should therefore provide the opportunity for the member states to harness our collective wisdom towards addressing the common health challenges we face. Honorable Chairperson, while we remain committed to the global health security agenda, we should take recognize of our region's vulnerability to public health threats posed by the communicable diseases. The ever-increasing cross-border movement of human and animal makes the control of communicable disease even more challenging. The region is still gripped with a huge burden of tuberculosis at a time when antimicrobial resistance is slow but sure setting in. We have, in recent years, witnessed a gradual increase in the prevalence of drug-resistant strain of tuberculosis. We have similarly witnessed sporadic outbreaks of viral hemorrhagic fever, Ebola, yellow fever, Rift Valley fever, dengue, and Marburg. Cholera has also been a nuisance in some of our member states. Honorable Chairperson, as we all look at the new era of cooperation, may I call upon members of the Eastern and Central South Africa health community to strengthen our health system so as to enable the region effectively manage their public health threats. I'm aware of the investment that the region has already made in cross-border diseases, surveillance and joint outbreak investigations, as well as the response mechanism. And I'm also aware of the investment made in improving our region capacity to diagnose tuberculosis and other diseases of public health concern.
We will be looking at how to mitigate emerging and re-emerging diseases in the region. We'll be looking at how to respond to the challenges on women's, children's and adolescent health. Under each of these areas, we have identified experts and people who are working in the region to share their experiences.
Then give you a sense of the way we at the World Bank Group see the current global and regional trends with a focus on health, obviously. And then very, very briefly present to you what is our current strategy. And finally touch upon some of the successful multi-sector collaboration upon which we can build. So first point is about why multi-sectoral collaboration. And this is the part that is usually emphasized in discussing multi-sectoral collaboration. So the point that also previous presenters made today, that health system encompasses both personal as well as population services, and these are all meant to achieve, to influence in terms of improved health, policies and actions of other sectors as well, meant to address the social, environmental, and economic determinants of health. So health intervention, for example, earlier in the day we were discussing the impact on road safety or NCD prevention and other, and for example through determination of food policies or tobacco industry regulations, etc. This is the part that is emphasized normally when we think about multi-sectoral collaboration.
A lot of investment has gone towards reproductive and maternal health equipment, and of note is that the ministry managed to procure anesthetic equipment as well as theatre equipment for our facilities to be able to offer surgical services. But like I mentioned, the issue of infrastructure has been a limiting factor as well as the issue of human resources.
From the discussions this morning and into the afternoon, one already observes that there are so many issues that cut across our countries. For example, the issue of fragmented health sector aid and lack of harmonization among health sector actors, which to a greater part is due to an evolving international aid landscape and changing accountability mechanisms for donor countries. Although there is a part that individual countries have to play to address such issues, working together as health ministers in the ECSA region can go a long way and strengthen our position in pertinent international deliberations.
Even issues related to what was presented by Dada Mwanyika about the companion choice for Tanzanian context. Yeah, okay. We don't even have a place where if you want to deliver or if you are admitted and then you can have your husband. Most of our public facilities, we don't have private rooms. Yeah, so that is a big challenge, but we're also trying to say now, things have changed. So we need even in our health facilities to have private rooms for delivery.
So that the countries contribute to the discourse, to say this is what we are actually doing, these are our challenges, this is the progress, this is how and we are looking forward to a very interactive conference as the experts, the ministers, the experts from the countries interact on the various areas.
with regards to the re-emerging and emerging diseases, I'm sure the point has already been belabored, and we all know very well that diseases know no borders. And it's quite interesting that when we're the Commonwealth, we have these issues coming up from different regions. And I'm sure you're already very much aware of the global nature of emerging diseases. But one of the strong points of the Commonwealth is this convening power. It's the ability to convene member countries with very little of a political agenda. No, it's been a very good conference, and it's a very good initiative because it's not possible to achieve any health targets or any health goals if the health sector does not work with other sectors. So the collaboration, multi-sectoral collaboration, is essential if health targets and health goals are to be met, and if the SDGs as a whole are to be met. The health targets and goals are very interrelated with all the other sustainable development goals. So the other sustainable development goals need health, and health also needs the other sectors in order to achieve its goals. So there's that strong interrelationship. So this theme for this meeting is really critical at this point when we are trying to achieve the sustainable development goals.
Especially the fact that when we come up with the strategy, we're looking at different agencies, government ministries, for example, education, gender, youth, finance, local government. Is there any experience from countries with regards to interventions around adolescent girls and young women?
This is a problem that is not only in Tanzania, Kenya, and other countries, but I think it's all over most of the developing countries. And of course, we keep lamenting over this. To me, it's not just about the training. It goes back to serious issues regarding the numbers, the human resources for health at the facility level. You cannot expect one midwife to be on duty from morning to evening, attending to all these mothers, and you expect her to be the same person.
During my presentation yesterday, there are key messages I wanted to share with the audience. The first one is the burden of NCDs in Africa, and particularly in this region, in Eastern, Central, and Southern Africa. We are seeing an epidemiological transition in those countries where it was communicable diseases like tuberculosis, HIV/AIDS, which were the most prevalent diseases in those countries. But about 10 years ago, we are seeing a shift towards non-communicable diseases. So my first message was to sensitize health ministers, but also the entire audience of this new burden on our countries, which are not prepared to deal with these emerging diseases in our continent.